It is a very, very special day. Standing in this setting is exactly not the place I wanted to be. We truly wanted to be at the site of our new Bryan South Campus, where the anchor facility will be a new comprehensive community cancer center, and I just want to set the scene for you all. If we were out there, we promised our event planner it would be beautiful weather. There was going to be a gigantic tent with a very scenic backdrop with a rustic barn projecting images onto the screen. Right in front there, spaced between 8 and 10 feet apart, would have been invited members of the media. Over here would have been members of a very special family. Behind them, some generous supporters, and then physicians from Southeast Nebraska Cancer Center. So we so wish we would have been there rather than at this podium. But what we're going to try to do today is give you a glimpse of what life is going to look like post-COVID, and share with you where many, many, many people will beat cancer someday. So our lineup today, I'm going to give you some specific details for the media and then also for the public tuning in. And then I will be inviting to the stage Russ Gronewold, the Chief Executive Officer of Bryan Health, Dr. Nate Green, who is an oncologist at Southeast Nebraska Cancer Center, David Reese, who is our Vice President for Clinical and Support Services, who oversees cancer programs here at Bryan. And then we are going to show you a video. In this video, for members of the media, you can use what is said in that video as supplementary and sourced quotes for your stories. And more than anything, it's going to give you a real look at what is going to be developed on the south side of Lincoln to treat many people. It was a wonderful, wonderful COVID diversion for us this summer to be working with the physicians and the city and engineers and all kinds of folks to bring this together. And, you know, of a personal nature, it was such a welcomed relief to work with the creative team at Three Pillars and our internal staff to play around with drones and go out to this beautiful setting. And most of all, it was wonderful working with an incredibly generous family that we sure wish John Sampson and Corey Vacoon and their families could be there with us today. After the video, we'll open it up for questions for any of the participants. So quickly with the details. We are celebrating today the gift of 28 plus acres from John Sampson and Corey Vacoon, which will become the Bryan South Campus. The anchor facility will be a comprehensive community cancer center. It is a $45 million project with $35 million of it self-financed, $10 million of it coming from construction. Today is also the formal announcement of a campaign for our comprehensive community cancer center. That first $10 million will trigger the construction to begin building the cancer center. The second $10 million will be for a programmatic endowment. It will be a 140,000 square foot facility, which will occupy about 1/3 of the acreage of the 29, give or take, acres out there. What you will have at this cancer center is certainly infusion, imaging, treatment, a multidisciplinary clinic, a breast cancer center, and more. Some additional things that is provided to the media in the press release, different treatment options that will take place there are certainly clinical trials and new treatment. Treatment planning with evidence-based national guidelines, a rehabilitation gym and therapy gym, genetic counseling, a specialty pharmacy, different care aspects that will be at this cancer center, which will be so welcomed in this community. Nurse navigators will be there to guide care. Palliative care services for those to ease discomfort and transition. There will be an image center where people can go in and get wigs fitted and styled, breast prosthesis fitted, and then cancer-sensitive apparel. There will be social workers there, and there will be care monitoring and constant quality improvement. Additionally, the proud tradition Bryan has in mental health, there will be mental health services for cancer patients out there. There will be spiritual care opportunities, financial assistance, nutrition counseling, and more. Subsequent facilities on the land are not yet determined. And just in our primary service area alone, which is Lancaster, Gage, Saline, and Seward County, right around 9,000 patients need cancer care a year. This will be tremendously needed, important, and a great service that we are so pleased to bring to the community.
Good morning. The planning for this comprehensive community cancer center began over 9 years ago as we started bringing various stakeholders together to try and understand what this could look like, what were the real needs that needed to be addressed with a comprehensive community cancer center. And it started to kind of resonate from a vision standpoint with everybody probably about 3 years ago. And so we started that planning process at what seemed to just be the right time in that whole 9 years. There seemed to be something that just brought us together just about 3 years ago. And so we began the design process, working with cancer patients or former cancer patients and various stakeholders to get to where we're at today. Today we're making the capital campaign officially public, and I'm pleased to announce that we have already secured $7.4 million from a number of generous donors in philanthropic support toward the $10 million construction trigger. So I just want to thank everybody who's already stepped up and said, this is something that Lincoln needs, this is something that we're passionate about and are ready to give to. Most specifically today, I want to say thank you to John Sampson and Corey Vacoon. We wish we could have been there to celebrate with you and your families together, but I just want to tell you we appreciate your generosity, your thoughtfulness, and just the spirit of care for cancer patients in the city of Lincoln that you've shown throughout all of this. What does almost 30 acres do for us? Well, first of all, it's going to be in the heart of the growth of Lincoln, right where we're planning on having that campus, right where it's located today, is right where Lincoln is headed in its growth. And I'm sure 10 years from now, we'll be surrounded by a lot of different things there. But it's also a place that we understand is very effective from a transportation standpoint. Bob and his team, I think, have driven from every point around, from Ashland all the way over to the site to see what all of the drive times are, and we've found that this place is as convenient as any, not just for folks in the immediate area, but also for our partners, our partnering communities down in southeast Nebraska, south central Nebraska, central Nebraska, all of those. This is a very convenient site going forward for all of those. But also, as Bob started to mention, this is really a footprint for future expansion to grow as Lincoln grows for other healthcare services that we might need. Again, we don't have plans for those today. We've plotted out where buildings and parking lots can go, but we don't have anything in particular planned. But again, I would say as we see Lincoln growing, there's going to be a need for care that we will be willing and able to use the rest of that campus for. Let me turn just for a moment to the working relationship that we have with Southeast Nebraska Cancer Center. We would not be here without them. They are tremendous physicians. If you look at their cancer outcomes today, they have tremendous outcomes, but more importantly, they share the vision for this. They share what's needed among cancer today and going forward into the future. So we couldn't be doing and designing like we are today without them. I also want to acknowledge Dr. Rick Thompson, who helped spearhead this, leading our site visits and lending his expertise in cancer care and surgery as well. So what will a community care cancer center do for us, do for care in Lincoln? Well, 3 things that I just will mention here this morning. Number 1, it will remove what we hear is the biggest issue facing those going through cancer care, and that is a confusing fragmentation of services to try and get while they're try to get through their course of treatment. It's also going to provide the highest level of cancer care in the area with a prioritization on personalization. And what that simply means is, as we've designed this and will continue to design this, the patient is at the center. Providers won't be at the center, the patient will be at the center of all of this care. The second thing it's going to do is allow us to continue to recruit really good talent to Lincoln for cancer care services. And I'm pleased to announce just one example of that today. Today I'm going to announce to you that Dr. Rachel Gendrell will be joining General Surgery Associates. She comes from us from North Carolina and will be joining us later next year to be the only fellowship-trained breast surgeon in Lincoln. And a key factor for her coming to Lincoln was the fact that we were going to have this new cancer care, this community cancer care center that she was able to kind of touch and feel virtually and get a sense of where we're going in Lincoln on this. The third thing is the issue of racial disparities. We know that health disparities exist among cancer patients throughout the nation, especially when it comes to early screening. And if all we do from all of this is just do a better job of taking care of the patients who line up with cancer, that will be a good thing and will be better than where we're at today. But we know that those disparities exist. And one example is, for example, in early screening from women of color and white women, with women of color having much lower early cancer screenings. You know, if we're going to be a community care cancer center, we need to address that issue. We need to make sure that we're getting them at their earliest stage so they have the best chance of a great outcome. And so in states that have had Medicaid expansion, like we've just come into, we know that many times those disparities start to narrow. And that will be an area, health disparities in cancer care, that we will be looking at accurately as well, or actively, as well. In summary, we couldn't be more excited to get going. We couldn't be more grateful for the Sampsons and other supporters. So thank you very much again to them.
Good morning. The physicians of Southeast Nebraska Cancer Center are excited to be taking part in this project that will change cancer care delivery in this community. Lincoln is fortunate to have many highly skilled medical professionals. However, there's a barrier to optimal cancer care that centers around central access and coordination. Care is often fragmented, requiring patients to travel and attend multiple appointments in different locations. We feel that healing happens best in the comfort of familiar surroundings, not at a stoplight, not on the interstate, and not at an airport. This new center is a huge step toward improving the coordination of care and the patient experience. Southeast Nebraska Cancer Center is dedicated to providing comprehensive care to oncology and hematology patients in a progressive and compassionate setting. We have 7 medical oncologists and 2 radiation oncologists. We also provide diagnostic imaging, a full laboratory, an in-house pharmacy, genetic counseling, occupational and physical therapy, a registered dietitian, palliative care, and a growing research department. We recently have become a member of the Eastern Oncology Cooperative Group, as well as an affiliate of MD Anderson Cancer Center, which of course are 2 highly respected National Cancer Institute research networks. The goal is to provide access to cutting-edge clinical trials closer to home. We have spent countless hours over the last 3 years meeting with patient focus groups and other specialists that are involved in cancer care delivery to find out what they would want and need in a center such as this. We have also consulted with groups around the country that have already implemented similar programs to make sure that we get it right. We have long had a vision of taking cancer care to another level in our community and surrounding region. Partnering with Bryan Health has allowed us to make that dream a reality. We're excited that Bryan Health shares our commitment to innovation and providing comprehensive, compassionate care to the patients of Lincoln and the surrounding area. I would like to once again thank the Sampson family and the multiple other donors that are making such meaningful gifts towards this project.
Good morning. My name is David Reese. I'm Vice President of Clinical and Support Services, and I've been here at Bryan for over 23 years. And have the opportunity to get a chance to work with Southeast Nebraska hematology oncology physicians and many others regarding our cancer program. One of the objectives going forward as we continue to develop the Cancer Center, our program, was bringing someone on that has the expertise and the knowledge base to help us go to the next level and help us continue to lead and develop our Cancer Center. And we did just that. We have an individual by name of Sue Schreiner that has been here at Bryan Health now for over 5 months. Unfortunately, Sue could not make it here today, but Sue has an extensive background. She was the director of oncology services at the Fred and Pamela Buffett Cancer Center at Nebraska Medicine in Omaha, Nebraska. And at the Cancer Center there, she was intimately involved in the strategic planning and activation of the center, and actively involved in development of programs there as well. So we're extremely excited to be able to have Sue on board to bring her expertise and bring her knowledge base to Bryan Health for us to continue to develop our cancer program. Some of the things that we're going to be working on to expand our cancer program along with the physicians is development of multidisciplinary clinics, survivorship programs, genetics clinic, as well as expansion of our nurse navigator program as well. So Sue brings a vast knowledge base to our cancer program that we'll be able to continue to grow and develop our program into a premier comprehensive community cancer center. So excited to be able to have Sue on board as our new oncology center director.
Well, my mom first was diagnosed with cancer when I was a toddler, but I remember her telling me that she had cancer. And then she had a couple different types of breast cancer throughout her life and ultimately lost her life to breast cancer. So my family's lived with cancer in our lives for pretty much my whole life. Being from Lincoln and living that for the last 45 years and watching how that's treated, handled, and what's available to support people with cancer, it's important to our family.
She enjoyed life, everything. Didn't matter if we were outdoors hunting, if it was a cold winter day inside having a cup of coffee and just chatting. She enjoyed every day she was alive.
You know, we've been thinking about this project for 9 or 10 years, and we've been working to put this all together. But what Bryan does is reflect what the community needs, and the community has really stepped forward and said, we want this to happen. And nothing could be more evident than that than a gift of 30 acres to Bryan at this time.
April and I drove out here probably 20 years ago, and we pretty much picked this location, and this quarter section was the first one available. It was her vision and my vision that we would want to stay in this part of the town, so we could sure we could formulate the right use of the ground, and certainly this is the right use of this land.
One of the things that we really have loved about this particular site is the healing environment that it presents to us. Cancer is not something that happens just once, one treatment and you're done, but this goes on typically for quite some time. And you want to go to a place that's a destination that has been redesigned in a way that makes you feel like you're in a most positive healing environment you can have.
If you are feeling good about yourself, you're feeling good about what you're seeing, if you're feeling good about the environment that you're in, there's a lot that goes with the mind-body connection. A lot that I don't think we fully understand in any discipline. But if somebody's mindset is one of positivity, they tend to do better than if they are not in that type of mindset.
Yeah, I think people in the region really deserve a leading-edge progressive cancer center, one that really is focused and designed around the patient.
Lincoln's medical community is very unique. The physicians here, in general, I would say all know each other. However, care can still be fragmented. So one of the things that we're hoping to accomplish with this cancer center is to centralize that care. Bring all of these specialists together under one roof. That does nothing but improve the patient experience.
The reason we chose this location is it's just such a beautiful location just in itself, the environment around us, but more so as we see where Lincoln's growing, and we've looked where Lincoln's growing, where's the surrounding community going. This is going to be right smack dab in the middle of it. This is going to be a place with the Beltway coming in where all of those folks will be able to get to us as quickly as can be. From the north part of Lincoln to central location to all around the state, this will be a very convenient place for them.
Patients coming to a multidisciplinary cancer center will help them to not have to worry about being at this place at this time on this date, but yet having another appointment in another place and trying to manage all of those various appointments that they have when they have to travel throughout the city, throughout the country, throughout the state to do all of that. Plus, with an all-encompassing cancer center, not only will they get their treatment there, but their supportive services. So if they need to see a nutritionist, they'll be there. If they need to see a physical therapist, an occupational therapist, there's going to be a survivorship program there to help them even after they have gone through their treatment to figure out, now what do I do? How do I get myself back to my new sense of normal and move on with my life?
If we're going to have a leading progressive cancer center, comprehensive community cancer center, that can only be done with the partnership of a number of really great physicians. And we're very fortunate to have in partnership and development with us oncologists and radiation oncologists and hematologists that have stepped right up and said, we have the same vision that you have.
From a physician standpoint, it's just exciting. We're going to have research, we're going to have treatment on site, we'll have colleagues to collaborate on site. And I think as it opens and it grows and matures, it's just going to build. And there'll be even more subspecialists there to elevate the level of cancer care within Lincoln.
I think this center is going to do incredible things as far as recruiting new talent in the healthcare field to this community. This center is going to help demonstrate our commitment to providing state-of-the-art care for our patients. It's going to prove that the physicians in town are willing to come together and collaborate to do the absolute best thing for our patients.
To address the journey of healthcare, particularly when you have cancer, is a very soul-searching item. Getting this care under one roof is going to be so huge that generations to come will expect it as an everyday thing, where those of us families, and every family in Lincoln's been affected by it, have had to deal with fragmented care, not by any fault of any doctors or medical group, just that's the reality we deal with. And to have the continuity of it all centralized in one spot will be so refreshing and uplifting to folks beyond their imagination today.
I think my mom would be really proud of my dad and I for the vision and working with Bryan to do this. It's a way to give back to not only Bryan, but to our community. I think she would have really appreciated that this was going to be better for everyone else that was in her shoes, because it's a tough road. It's a really tough road. And anything you can do to make the road a little less rough, she would be happy about that.
Yes, our goal is this summer. Again, we need that $10 million trigger. We think we're on pace to meet that, so we are preparing to start putting this into action this summer.
In context to the question asked, when would we open up for operations? Once construction begins, we would foresee about an 18 to 24 months construction cycle for that to occur. And then you'd have some time to get it fitted out, operations, and set up. So somewhere between that 18 to 27 months of time frame for construction to the point of opening once construction starts in that area.